The hymen is a thin, flexible membrane of mucosal tissue located at the entrance of the vaginal canal, and it is one of the most commonly misunderstood structures in female reproductive anatomy. So today, through this three-dimensional medical animation, we will explore its biological nature, its natural variations, and its clinical significance in a factual, science-based context. The hymen is present from birth and is part of normal female anatomical development. It is not a solid barrier, but rather a partial covering with one or more natural openings that allow for the passage of vaginal secretions and, later in life, menstrual flow, and its size, shape, thickness, and elasticity vary significantly from person to person, which is why gynecologists and anatomists have classified it into several distinct types. The most commonly observed form is the annular hymen, in which the tissue forms a complete ring around the vaginal opening, creating a roughly circular or oval aperture in the center. This type is frequently seen in newborns and young children and is considered the most typical anatomical presentation. The crescentic hymen, sometimes called the semilunar type, features tissue that covers only the posterior portion of the vaginal entrance, resembling a crescent or half-moon shape, with the upper portion largely absent. This is actually the most commonly identified variation in adolescent and adult females, and is considered entirely normal. Moving further through the classification, the septate hymen is characterized by a band or bridge of tissue running across the center of the vaginal opening, effectively dividing it into two separate apertures. This type can sometimes cause practical difficulties such as pain during tampon use or gynecological examination, and in such cases, a minor outpatient procedure may be recommended by a healthcare provider. The cribriform hymen, derived from the Latin word for sieve, features multiple small perforations spread across the membrane rather than a single central opening, giving it a mesh-like or latticed appearance under clinical examination. And while menstrual flow can still pass through, it may do so slowly, and this type is sometimes associated with recurrent infections or discomfort, which can be addressed through simple medical intervention. One of the rarer and clinically significant types is the microperforate hymen, in which the membrane covers nearly the entire vaginal opening with only a very small central hole. So small that menstrual blood may take longer to exit the body, and tampon insertion may be difficult or impossible. Adolescents with this type often first notice it during puberty when menstrual cycles begin, and it is treatable through a procedure called hymenotomy, performed safely under local anesthesia by a trained gynecologist. At the far end of the spectrum is the imperforate hymen, a condition in which the membrane completely covers the vaginal opening with no perforation at all. This is the only variation that is considered a medical condition rather than a normal anatomical difference, as it prevents menstrual blood from leaving the body, leading to a condition called hematocolpos. It is typically identified during adolescence and is corrected through a straightforward surgical procedure with excellent outcomes when addressed promptly. The fimbriated hymen, also described as a hymen with irregular or fringe-like margins, features soft, uneven, naturally undulating edges along the tissue. This variation is entirely normal and is simply a reflection of the natural developmental diversity in soft tissue formation, and should not be confused with signs of injury or abnormality. The elastic hymen, sometimes referred to as a resilient type, is notable for its unusually stretchable tissue, which allows significant flexibility without tearing. This variation highlights an important anatomical truth. The hymen does not necessarily rupture during physical activity, tampon use, or other routine events, and its presence or appearance cannot and should not be used as a marker of any individual's personal history, a point that modern gynecology and human rights organizations strongly emphasize. It is also important to understand that the hymen undergoes natural changes throughout life. Hormonal changes during puberty cause the tissue to become more elastic and may alter its appearance. And over time, through normal physiological processes, the tissue may further change, becoming less prominent, all of which are part of healthy, expected biological development and not signs of any medical concern. In pediatric anatomy, the hymen is typically annular or crescentic and quite delicate, and its examination, when medically necessary, must always be conducted with the utmost sensitivity and in accordance with established clinical protocols to ensure the comfort and dignity of the patient. From a clinical standpoint, understanding hymenal variations is important for gynecologists, pediatricians, forensic medical professionals, and patient educators, not only because it enables accurate medical diagnosis and appropriate intervention when needed, but also because it equips healthcare providers to give accurate, reassuring information to patients who may have concerns or misconceptions about their own anatomy. The wide range of normal hymenal morphology is a clear reminder that the human body exists on a spectrum of variation, and that anatomical diversity is not pathology, it is simply the nature of biological development. As we conclude this educational visualization, the key takeaways are: the hymen is a normal anatomical structure with many naturally occurring forms. Most variations require no medical treatment. Clinical intervention is available and effective when a variation does cause discomfort or obstruction. And accurate anatomical education is essential for both patient well-being and the advancement of respectful, informed healthcare. And it is through animations and educational resources like this one that we continue to build that foundation of understanding, one informed viewer at a time.